Robert Koss, 741. Yeah, we're definitely going to continue this conversation, but I wanted to switch gears a little bit. One of the bigger conversations is reopening the island on Monday in baby steps. And we have from the Guam Women's Chamber of Commerce, Holly, who is also on the Governor's Recovery Panel of Advisors, Holly Rustick. Thanks for joining us, Holly.
Good morning, Holly.
Good morning, Chris and Sabrina. How are you guys doing?
We're doing pretty good. I just kind of wanted to get the 411, if you will, on what you guys are planning to reopen, what you advise the governor, and how those reopenings are going to go on Monday when we go into PCOR2.
Right. So, we've had different things published, and I think people have been able to see what kinds of businesses are open at this time or will be opening, and we're projecting, of course, for May 11th. So looking at some of those, of course, is professional services. We have different types of automotive, real estate, and the list goes on and on. So we do have that published on our website. So we do have quite a few that are coming out, which is fantastic as we go through this. And even if, your business industry might not be on that list at this point in time, it's not necessarily that your business has to wait until PCOR3. PCOR2 is more of a phased-in approach. So the governor will be looking over, and public health will be looking over different plans if your industry wants to submit plans that has not been published on this list right now. And they will be rolling this out as the medical data can kind of, navigate and show what can be open throughout this time.
And what can you tell us about that process? Because we know that in talking about reopening the island, there was part of it was we're going to do these gradual reopenings of businesses that were previously closed, but we're also going to be monitoring them in terms of exposure and risk and COVID-19. So what about that part of it, Holly? What can you tell us about that part?
Sure. I mean, I'm not a doctor, but we have been working closely with, the doctors, CDC, everything. And what they're saying is that goes back to the PCOR1 kind of trigger. So if you look at that as far as expanded testing, positive rates, the less than 10%, being able to do contact tracing, all of those indicators. So those will continue throughout PCOR2, and those will really guide how businesses can open. So as we keep opening, of course, as if more tests are coming in, right, and we can contact trace and do all of those things, then the data is really going to show what can be opened. So everything is medically driven, and our part in this, as far as the Chamber of Commerce, the Guam Women's Chamber and the Guam Chamber of Commerce, is to really assist with just being able to communicate for businesses, advocate for businesses, and we've developed the industry guidelines just as guidelines to be able to assist maybe those smaller businesses that they're not sure what to do to be able to open. Yeah.
So when these businesses reopen, retail stores, professional services, flower shops, real estate and automotive sales, and like you said, the list goes on. When they reopen, are they going to have limited hours, or what protocols need to be in place?
Right. So what we were able to do as a subcommittee team, we were able to really look and say, okay, we reached out to our members. So Christina and I reached out to our different members, and we said, hey, you guys that are in the industry, if you want to submit any guidelines that you've already put together, or maybe your corporates have put together, if your franchises, or if you operate underneath, corporate lens, then like Macy's, right? Macy's submitted a plan from their corporate office. So they went ahead and they the members responded and gave us some information, which is fantastic. And then we also did our research, of course, and looked at national and international guidelines and protocols. So what we did was then we just kind of streamlined those into industry-specific guidelines to be able to say, here are some recommendations, which will probably turn into standards at point, although they're not right now, but they are guidelines. And here's a safe way to operate that's, using the data that people have so far, as well as, being able to stop the spread of COVID-19. So here are things that have been indicated, and these are things that you can do in your business. So yes, you want to open small, right? You are not small, but you don't want to you can't have your entire store open right now to some degree. Right. But you just have to follow those guidelines as far as, and the thing is businesses, they don't want to put themselves, their employees, or their customers at risk, right? So they were like, okay, we have these guidelines now, and it's really up to that industry then to say, okay, how are we going to roll this out? What do the guidelines say? What do we need to follow? Obviously, there are some requirements for certain industries, like We're not doing sit-down food courts, food and food courts right now, that sort of thing. It's more takeout still. There are some kinds of, rolling out slowly in some industries. But really it's about having these things in place that you can promote confidence again with with the community, to public health, right? So it's following those minimum guidelines.
Mm-hmm. And who approves these guidelines, and then who is going to enforce them?
Right. So there is also I know Ricky put together, which was fantastic, approved through public health, which is the pandemic minimum requirements. So, and a lot of those are reflective in the industry guidelines that we created since we've been working very closely together. And those are the ones that are minimum requirements for businesses to follow. The industry guidelines are more specific, right? Because the pandemic minimum requirements are more like cover all business general. Right. Yeah. And then the ones we developed are like, obviously like, people doing hair, you're in closer proximity. There's certain things that you need to have in place specifically for your industry. The same for restaurants, etc.
Can you tell us a little about the shopping center? So, Micronesia Mall, GPO, Agani Shopping Center. Yeah. I think there's probably a couple. What are the protocols going to be for these guys once they reopen? And what are the limitations for the customers? Because I'm pretty sure that, or are they just allowed to go and hang out at the mall all day?
No, yeah, so they're really discouraging loitering, and I think that's the biggest thing, and that's what I was saying. Like the food courts, you can go order food, but it's for takeout. It's not to sit down and have your food or to loiter or the kids playing, that sort of thing. Right. It's just to limit so you can still go and get your shopping done, right, if you need to pick up something from the stores. And, really those are retail stores, and they operate in a combined building, right? So it's really being able to open up the retail side of that, and for customers to be able to come in and do their shopping and the businesses to open. But, looking at more of that congregating, that would be later on down the road.
Right. Mm-hmm. Mm-hmm. So how does that work? Let's say just, hypothetical, anybody who's ever been shopping with, their other half or family member, sometimes the pace is so slow, it's almost like it's loitering.
Right.
So, for example, we go over to the mall, if you go to Macy's or whatever, is it gonna be like, hurry up, come on, let's go?
I don't think so. I don't think so. But I think at the same time, all of these guidelines, everything that's been developed, it really goes back to values, right? So it's about respect. Like, none of us want to get sick. None of us want to see our family members get sick. None of us want to see our community members get sick, right? So it's just going back to, there's this thing going on in the world, and there's not a cure right now at this point, but we still want to operate, and we still want to go out and enjoy life, right? So what can we do to be safe and to be respectful for others? And if, that means, I'm not going to loiter as long, like looking at clothes so long, maybe I'm just going to give myself a certain amount of time to go in and get what I need and leave, because that really benefits the community at whole.
God, that sounds so heavenly, Holly.
Mm-hmm. Yeah.
I mean, we're just going to go in and we're going to just get what we need, and we're going to leave.
I'm not sure, Holly, if you had answered the question regarding who's going to be regulating whether or not these businesses are following the minimum pandemic workplace operational requirements. And if public health is not going to be out there inspecting, is there a hotline number or a number that people can call to report who's not following the guidelines?
There is a number, and this is really, I'm glad you brought that up, Sabrina, because it really is based on self-regulation in a lot of ways, and it's based on, the public, of course, is going to report, right? I mean, that's just what it's going to come down to as far as, and I think that goes back to, I know, Chris, you're like, it sounds so heavenly and ideal, but, it's respect, and if you see something that's happening in the community that looks like disrespect, as far as people not taking care of sanitary things, then people will report. That's just how how we are, right, as people. So it's really about us self-regulating, and there are numbers to call. I don't have that specific number off the top of my head, but I can send that to you.
Okay, yeah.
Yeah.
And just for, we know which businesses are going to be reopened come May 11th. That's the target date. What about, I know that in the initial presentation by Ricky, there was the column on the right, which was the spas, the gyms, a couple of other golf courses, a couple other industries. I know that it was mentioned that there is still the possibility that they can open within PCOR2, right? What do they need to do?
Right, and it's really the same thing, and this is what I had said in the beginning, like it doesn't necessarily have to mean if your business is on the list, it's not there in PCOR2 that it can't be in PCOR2 at some point, right? So they just have to submit their industry guidelines, and they can submit those to public health. And it's basically, it doesn't have to be each individual business, and we just wanted to make that clear, like, because that's a lot of work, and who has, we don't have the staff or capacity to review every single thing coming in. So it really is based on the industry. So say if I have, a salon, and I already know the industry has provided that, I would just look at those guidelines and make sure that I'm following those, right? I don't have to submit extra things. But if I'm not on the list, like you said, golf courses, those sort of things, they would just be, preparing their guidelines now if they haven't done so already, and then they would just be submitting them and just wait for the announcement.
Okay. Yeah, I have a copy of Public Health's workplace requirements, and then they do submit their guidelines to PCOR2 plans at dphss.guam.gov.
So Holly, are these businesses that are kind of on the bubble, are they making concerted efforts to discuss with the Recovery Panel Advisors or Public Health how soon they can reopen, or are they just like, oh, we're not on the list? So.
No, absolutely. You know what, Chris, they actually, there's several industries that have already submitted their guidelines, and like I said, the Guam Women's Chamber of Commerce and the Guam Chamber of Commerce, we've both been receiving industry guidelines and just being a conduit to support that. Right. So we already have things ready to go. So literally as soon as the governor announces for the next opening to be, she can start looking at these guidelines for the time being. So it benefits the businesses entirely to be prepared, to already be submitting things, to be really thinking out their plans on how they can roll out. You know what I mean? So to just be prepared.
What happens? Sorry. What happens to, you said it was self-regulation with people reporting into public health if they see something that's not following the guidelines. What happens if it's found that they aren't? And are there repercussions?
Yeah, because right now they could lose their business license.
Well, right now, there's nothing standard, like there's no standards built, right? We're going through this, we're rolling out this plan, but basically what it means is that businesses could collectively all go back into PCOR1, and nobody wants that. Wow. The community, we don't want to re-shut down, but the thing is, if you aren't following these things, you could then start, the spread of COVID again. And then since we're doing this on a medically data-driven, point, if those start spreading again and we're not below the 10%, we have to go backwards, right? You know what I mean? So it's not something that says your business has to shut, but it's like collectively, this is a collective process, right? So,
I wanted to ask you because it's Mother's Day weekend, and I know a lot of the moms are just so concerned and really wondering about the reopening of the golf courses.
Yeah, the golf courses aren't on the list right now, unfortunately, but we are pushing for that. They are really prepared, and they'll be considered at a later time.
It's not just there's the swimming pools that's on the right side.
I mean, is the pool even working?
The bingo halls are on the right side.
Yeah. And, it's just, once again, we're going through this plan, and each state, each country is completely, different, but there's some similarities in how they're rolling this out. And as we see the data, even collecting case studies from other countries that may have opened up earlier than us, it's really seeing what's been working and what hasn't been, and kind of following that, So.
Right. What about...
And then, go ahead, sorry.
I was just going to ask, so once we go into PCOR2, then we monitor for the next 14 days from May 11th to see if all of the triggers are still intact and everything's okay, then we would move into PCOR3.
There's actually, originally it was a 28-day process.
Was it? Oh, yeah, I thought it was 28 days from PCOR1.
Yeah. No, PCOR1 to PCOR2 is 14 days, and then the PCOR2 is actually a longer period. Okay. However, saying that, there are phases within PCOR2 that can be examined. For instance, they might in a week say, okay, let's figure out what's been going on with the data trends. Have we been still expanding our testing? Have we been doing the testing? Have we been doing the contact tracing? Yes. Okay, what do the numbers say? Below 10%? Okay, so we can make another decision potentially now to open up more businesses, or just more, even like churches, those sort of things, right? So we're not just looking at businesses. This is an entire ecosystem. Even the daycare centers and the schools, you know what I mean? They're also being like, okay, let's watch this as it rolls out, right? So really looking at how we can interact more in the community, and that's all going to be based on those medical triggers.
Holly, what do you know about...
I'm sorry, but do we have to wait 28 days after PCOR2 in order to be...
No. No. Yeah,
it's
that's what
just
I've been saying
based
the whole
on
time. It's looking at rolling out the 5-day kind of the math, right? Like looking at how this all rolls out together, and they're looking at it in different ways. So it's looking at phases within PCOR2 instead of it just being like, you're in PCOR2, this is what you can do, and then as soon as we hit 28 days, this is PCOR3. Like, that's not what it's saying, because we're looking at the data as it comes through and aggregated. And
these doctors, they
know how to look at that specifically.
Yeah, we get the wrong data, they'll shut it down, right? The doctors.
I don't think they're going to shut anything down, and that's not what I'm, trying to say. Is they might just say, well, we need to wait a bit longer to open things up, right? They might say, you know what, that if you're only having 25% of people in your store, or meeting one-on-one with people and doing appointments, let's just continue that a little bit longer, because it's starting to spike, or there's another wave.
Right.
Those kind of things. So it's not like we don't want to just go back to PCOR1, and that's not what I'm saying. I don't think that would happen, because now people are going out there and they're putting better measures in place, right? So all of a sudden, there's contact tracing. You're wearing masks to your business. It's not like before where it was just everything's open, right? So the risk is huge.
Right.
So now we're implementing measures in place. So in that regard, businesses can still operate. There's a lot of businesses too who have gone online. They've pivoted their business structure, their operations. So they're continuing to operate because they have less risk exposure. So they're able to operate in that kind of way.
Right.
So it's also looking at innovation.
What are the industry standards saying? And I know it's early, about the movie theaters. Have you got any plans or heard anything from movie theaters?
I have not. No. Yeah.
And that would be a PCOR3 all the way, right?
I can't say for sure, but yeah, I don't know. Okay. I mean, that's just something that we haven't even, we haven't seen on the list yet, because that's just,
Okay.
What discussions are being done regarding tourism?
Right. There are discussions going on already, and I know there's a subcommittee directly developed for that specifically, because that is a longer term plan, approach, right? Like, flights need to figure that out, and know what's going on. I think it's 45 days beforehand. So they're already planning and starting to work on that, and so that's a good thing. I don't know the direct information because I'm not in that direct subcommittee, but I do know that it's being worked on, absolutely, because of course Guam's industry is reliant in many parts to tourism, right? A lot of our businesses and everything. So that is taken very seriously, to look at. So
well, we thank you for sharing with us the information that you do know about Holly. Appreciate it so much. And anything in closing that you want to add on what could be the last Friday under this type of lockdown?
Yeah, I just wanted to add real quick, right when this first started and we had our first COVID patients pretty much starting on Guam, my daughter actually was a presumptive COVID case. And I know 2 people in the community that are positive. So I just want to add that, this has been it hit me pretty hard real quick. And I'm sure all of us, right? And just to go back to, none of us want to get sick. None of us want to see that in our family. It was the worst 2 weeks of my life. You know what I mean? So, and just looking at that and saying, how can we, as we open up, but we don't want to stay home forever. My daughter wants to get back to dance. She wants to get back to doing things. All of us want our kids to go back to school, but we really need to do this as a community. And I think if we go back to how can we respect one another in doing this and everything we do, instead of oh, I have to do this or you have to do that. It's not about that, right? It's about, once again, going back to we care about our family, we care about our community, and how can we do this really together? So, yeah, that's just what I want to leave the note on.
Well, thank you, Holly.
I'm glad to hear that your girl's doing better.
Yeah.
Thank you.
And I, too, want to get back into dance.
Oh, yeah.
All right, take care, Holly, and thanks for all your work on this plan.
Yeah.
Absolutely.
You wash your hands.
That's right.
Okay.
Take
bye.
care.
Hey, it's 8 o'clock. We're KUAM FM in Hagåtña, Guam. Good morning. Jumping over to TV 11, KUAM TV 11. Thank you guys so much. Good morning to our viewers over at the Government of Guam Hotel Quarantine and Isolation Facilities. We're going to do news, COVID-19 headlines coming up with Serena Salas, Matt Tanani. And we'll start the show here at